Hey everyone, thanks for checking out my channel. On this video, we're going to go over cervicogenic dysfunction, that pain in the neck area. Maybe you're having headaches on one side of the head, jaw pain, upper trap pain. I'm going to go over some techniques you can do to resolve your symptoms at home. Cervicogenic dysfunction is irritation or aggravation of the upper three cervical vertebrae. So C1, this is C1, C2, and C3 would be underneath this. Now, this model is larger than an actual skull and vertebrae, but just for demonstration purposes. So in this area, you're going to have irritation. And that can be from different things. It can be from an automobile accident, maybe whiplash, from a fall, neck trauma, all sorts of things can cause that irritation of those joints from arthritis. And so a lot of times this may be something that you just wake up one day, you don't know why it's hurting, it just started hurting. You've got this pain in your neck, maybe that radiates down around your shoulder blade area, comes up into the jaw. Sometimes it's mistaken for TMJ, pain in the side of the head here, and then you're going to have headaches, and a lot of times that's going to be what's called a ram horn presentation. So that pain is going to start in the back of the neck and it's going to come over on one side. It can happen on both sides, but it's typically only one side. And it may vary from side to side depending on how you're feeling that day. Maybe one day it's the left side, the next day it's the right side. But for a lot of patients, it typically stays on one side. So what can you do at home? Well, there are stretches that you can do, strengthening exercises, and some things to kind of reset the nervous system. I'm going to demonstrate the flexion rotation test for the cervical spine. This test is my go-to to determine if someone's having cervicogenic dysfunction. Not only are we looking at the symptoms, the presentation, the history or mechanism of injury, we also go through this test. It's really simple to perform. Basically what you're going to do is your patient's going to be lying on their back. You're going to bring their cervical spine into flexion and then rotation. We're going to go to the left, in range rotation, and then we're going to go to the right, or whichever side you prefer to start with first. We're looking for a decrease in range of motion to either side. Say if one side has 70 degrees of rotation, the other side only has 30 degrees of rotation, then that test is going to be positive. As well as we're also looking for, does this recreate or exacerbate the symptoms of pain, dizziness, vertigo, headache, any of those things, kind of are brought on by that movement, then the test is going to be positive. So I'm going to demonstrate the flexion rotation test on myself. So if I were testing a patient, I'd be standing or sitting at the head of the table, and I'm going to bring their head and neck into flexion, and then I'm going to rotate either to the right all the way, and then to the left all the way. And then what I'm checking for again is that reproduction of symptoms, headache, neck pain, dizziness, and also looking for loss of range of motion. First, we're going to go over some stretches. Our first stretch is going to be a pec stretch because what happens a lot of times, we kind of get kyphotic like this, kind of rounded down. So we're going to open all of that up. So you're going to go in a doorway and lean in. And as I lean in, I'm feeling this stretch in the front part of my shoulders, my chest wall. I'm going to lean in and hold this for about 15 to 30 seconds. Come back out, go back in, lean in again, and repeat that several times a day. Our next stretch is going to be one of my favorite stretches. This is done either seated in a chair or you can stand to do it. You're going to grab a hold of the bottom of the chair or the front of the chair here, and I'm going to lean away. And I feel that stretch in my upper trap area through my shoulder here. And then what I'm going to do is apply an additional overpressure or stretch to my head and neck, kind of pulling that over to the side. Going to hold that again for 15 to 30 seconds. And then I'm going to repeat that to the other side. That's a really simple stretch that really can be beneficial for a lot of neck and shoulder conditions. Now we're going to look at some mobility exercises. So we're going to use this mobility strap. I'll put a link in the description for one of these. If you don't have one of these, you can use a pillowcase, and I'll show you that with a pillowcase as well. So I'm putting this at the base of my skull here, kind of in my upper cervical area. What I'm going to do is I'm going to look up, and as I look up, I'm going to pull this strap kind of at an angle up through my eyes. As I look up, I pull and I keep that pressure the whole time as I look up, and then I come back down, maintaining pressure the whole time. Relax a second, hold pressure again. As I look up, I pull up through the eye at an angle, and I'm going to repeat that for around 10 to 15 repetitions for 2 to 3 sets. Now I'll demonstrate using a pillowcase, doing that same movement. So we're going to take the pillowcase, go at the base of the skull here in the upper cervical spine. I'm going to pull up as I look up, hold pressure the whole time and come down. So again, I'm pulling up through the eyes and back down, repeating that for 2 to 3 sets of 10, 15 repetitions. Now we're going to work on rotation. Rotation in a lot of cases is going to be limited if you're having a cervicogenic dysfunction. So what you're going to do is take that strap that we used initially, and I'm going to turn and look to the left. As I look to the left, I'm going to pull on the strap. And so I'm pulling on the strap up through the eye, turning my head to the left and coming back down. So I'm going to turn, look to the left, pull up with the strap, back down, and then repeat that to the other side. So I'm going to turn, pulling up through the eye, maintaining pressure the whole time. So I'm maintaining that line of force the whole time and back down. You're going to repeat that for 2 to 3 sets of 10 to 15 repetitions. Now to demonstrate using a pillowcase for that same rotation, you're going to turn, look to the left, pulling up with my right arm up through the eye. I'm going to look to the right, and I'm using my left arm to pull up. And again, you're repeating that for 2 to 3 sets of 10 to 15 repetitions. Another great technique is using a foam roller for mobility. There is some research that supports that thoracic or that upper to middle back area mobilizations or manipulations of the joints can have a positive effect on neck pain, headaches, and improve overall mobility, not only of the cervical spine, but of the upper extremity. So what you're going to do is take a foam roller. There's all different types of foam rollers that you can use. You're going to put that down. You're going to put that in your upper back area. So you can kind of play with that and adjust where that kind of hits. And then what I'm going to do is just lean back over. You can roll back and forth on that, kind of work up and down, or you can just statically hold that, just kind of relax, hold that stretch maybe for 10 to 15 seconds, and repeat that several times a day. This is another great mobility technique what you can do. You can take a towel, roll that up, put that underneath the cervical spine, and just relax. Kind of let your head kind of hang back over that towel or rolled up blanket that you're using. Just kind of relax. Don't really do anything. Just kind of breathe through it. And maybe sit there or lie there for 3 to 5 minutes and repeat that several times a day. That's just a great technique to try to get some of those upper trap muscles and cervical muscles to relax a little bit. Now that we worked on our mobility and our stretching, we have to start strengthening the neck muscles. So what you're going to do is take one of these exercise bands, put that behind the head, and you're going to just kind of push back. You're retracting back, so pull straight forwards against the band, retract your neck and head back like that. You're going to repeat that for 2 to 3 sets of around 10 to 15 repetitions. Our next exercise is going to be a standing band T. So what you're going to do is take a piece of resistance band and about shoulder width apart. Just you can kind of play with that if you want your hands close together, farther apart, just kind of whatever feels the best to you. And you're going to work on pulling that apart. And as I pull that apart, I'm squeezing my shoulder blades together. I'm going to hold that about 2 seconds and come back. Pulling that apart, squeezing my shoulder blades together, and then come back. Repeat that for 2 to 3 sets of 10 to 15 repetitions. Next, we're going to perform a standing Y exercise. So I'm standing on this resistance band, and I'm going to pull up, almost like I'm trying to kind of come up and make up the letter Y. I'm going to come up and back down. Really focus on the control with this, kind of feeling where your shoulder blades are, keeping your arms as symmetrical as possible, and come back and forth. Repeat that for 2 to 3 sets of 10 to 15 repetitions. These are going to be standing endurance shrugs. I have a piece of resistance band that's under my foot. I'm going to work on shrugging my shoulders up, holding that for 5 to 10 seconds and come back down. Shrug up as high as I can, hold that for 5 to 10 seconds and come back down. Repeat that for 2 to 3 sets of around 10 repetitions. This is a deep neck flexor endurance exercise. So what I'm going to do is lie flat on my back. I'm going to tuck my chin in, so I'm going to bring my chin down. I'm going to bring the back of my head off of the mat, or if you're at home, off the bed or the floor, just a little bit, just enough to be able to put your hand behind your head. And you're going to work on trying to hold that position for around 15 to 30 seconds. Initially, you may only be able to hold that for maybe 5 or 10 seconds, but work up to really being able to control that, keeping your chin tucked. You're not shaking around. You're not having to recruit a lot of other muscles to come in and help perform that movement. That's something you're going to perform for 2 to 3 sets and hold that for around 30 seconds as a goal, once to twice a day. Thanks so much for watching. I hope this video helps with your cervicogenic dysfunction. Be sure to hit that subscribe button so you stay up to date on all my content.